Pick any American street or park or office hallway or store or restaurant. Somebody stops, staggers, and falls. What happens next could mean life or death. What would you do as a bystander? Would you perform CPR on someone you don't know? Would you respond equitably to someone in need? Every year, more than 350,000 out-of-hospital cardiac arrests happen in the United States. But only about 46% of people, that's less than 1 out of 2, who suffer cardiac arrest get CPR from a bystander. CPR, especially if performed immediately, can double or triple the chance of survival, the chance of living. People can be reluctant to jump into a life-saving situation. They may not know how to do CPR. There's 2 easy steps. Call 911, push hard and fast in the center of the chest at 100 to 120 compressions per minute. In some instances, maybe too many instances, people may hesitate for social reasons. The divisions and inequities that exist in society at large can affect what happens during actual medical emergencies. Hispanic and Black adults are substantially less likely to get life-saving care from a bystander than white people. Research has found this is especially true in public settings, such as on a street or in a transit center. Their chances of getting bystander CPR improved in situations in which they might be known, such as in a workplace setting. And women are less likely to receive CPR because people worry they'll be accused of inappropriate touching or assault. Katie Dainty has studied how people who aren't healthcare professionals respond with CPR in public settings. Welcome, Professor Dainty.
Thank you so much.
Social factors can be a big obstacle to CPR response, is that right? How can they be overcome?
It is right, actually. For a very long time, we focused on training, but I think we haven't really taken into account the fact that there's a psychology and a sociology to getting down and responding to an emergency, specifically for someone you don't know, as well as even if it's a loved one. And so I think paying more attention to the social factors, just even the society as it is today, in terms of, the idea of getting involved in someone else's business if it's a stranger, or understanding the psychology of having to save the life of your wife, husband, brother, sister, whatever it might be. It's a much bigger deal than I think we've ever understood. And so I think understanding that, bringing in other kinds of science to help us understand how to overcome those barriers, those social and psychological barriers, will be the key to improving CPR response.
So it sounds like there are mindset factors in addition to just mechanical factors.
Absolutely. So, we talk a lot about intention to do things, but there's, psychological and emotional and historical factors that play into the difference between intention and actual behavior, right? So I like to think that everyone in society has good intentions, but whether or not that actually translates into behavior is actually a pretty complicated system of psychological and sociological implications.
You've done a lot of research on bystander CPR. You've said that the response gap is not mostly about expertise or know-how. Can you quantify in some way just how many lives are in jeopardy because of bystander reluctance based on social factors?
In the United States, for example, if there's 350,000 to 400,000 cardiac arrests a year, and about half of those are witnessed, if we just use big numbers, say 200,000 are witnessed, and we only have a response rate of at best 50%, then there's 100,000 lives that could be saved that aren't, because there was not a bystander or someone who was willing to get down and help with CPR. And so I think that training is definitely not at 100% in our society as well. So it's a combination of training to have the skills, which makes you feel empowered to be able to respond, but also it has to do with public awareness, The awareness of cardiac arrest, the differences between cardiac arrest and a heart attack, and the idea that responding and doing CPR doesn't require medical training has been something that's hampered us, I think. For a really long time, we made training something that you had to spend a whole day doing. You had to have a card in your back pocket to do, and we kind of framed it as a medical act, and in fact it's not. And so we sort of have to change the messaging and increase the awareness around cardiac arrest and the fact that you can help someone, and that if you don't help, they're likely going to die. The actual level of importance of this are some of the ways I think that we can work with that. And certainly there are also really important societal nuances, such as different neighborhoods have different conceptions of getting involved in other people's business or calling 911 and the implications of that. I think we really have to understand culture. And in a multicultural environment like we have in North America and around the world, we do have to really understand the cultural implications as well of what it means to help and to be able to get involved in that situation, as well as touching someone else. There certainly are gender disparities that come into play and things like that. So it's really quite complicated.
So what I'm hearing is there are many factors, many of which can be brought into play, that have the potential of saving 100,000 and more lives every year in the United States. You talked about a lot of strategies to deal with bystander reluctance. Are there any that you might have missed or want to re-emphasize?
I think empowerment is a big one, and understanding the psychology of response in an emergency situation. I also think that we have to understand that not everyone, 100% of people are not going to be willing to do that, to get down and do that. That's just personality. But how do we also then at least raise awareness to the point that they understand the level of emergency and pull in someone who is willing, or go ahead and call 911. And a key piece I think that we also don't necessarily understand is that when you call 911, the dispatcher or the telecommunicator that takes the call will coach you through CPR, and they will stay on the phone with you until emergency services arrive. And I don't think people understand that there is actually help there. They just have to call 911. So that's a really simple first step that we have to, again, build awareness around so that people feel like they have the support to do what they need to do.
Is there anything else that we can say or do based on the current understanding of the problem?
I think it's about ensuring, positive messaging that this is something that you can do, that everyone can do. I think that this is a life skill. This is like swimming, driving a car. I think that CPR needs to be more framed like a life skill that everyone should have. I have a 10-year-old daughter. She can do CPR, right? So we have to build it in as part of our social fabric, that this is just something that we do as a society. We educate people, we train people. We make people aware. The countries in the world who have had success with higher bystander CPR response rates have that built into their societal sort of fabric and value. And I think that's a really important piece.
You talked a little bit earlier about neighborhoods and cultures and places where there may be a higher likelihood or a lower likelihood of bystander CPR. Are there ways that we can think about equipping underserved populations, underserved communities to better respond to these emergencies?
Understanding those neighborhoods, not making huge assumptions about that everybody is the same. And whether that be cultural, ethnic, race, gender, whatever the case may be, it's really about doing more research and just to really understand that so that we can figure out what those components are. I mean, we've seen the stats that show disparities in bystander CPR, but it's not only in out-of-hospital arrests in the public. The disparities are also in the home. And so there is something going on there that we need to understand. But then there are also neighborhood characteristics. There are neighborhoods we know that, calling 911, which brings the police to the neighborhood, isn't always what people are willing to do, right? For a variety of reasons. So understanding that and then working with the community and doing co-design research where we really bring them in and not study them, but do the research with them to, again, empower them to understand what they can do as a community, I think is really the way of the future.
Professor Daney, thank you so very much for talking with us about this important topic today. As you know, the American Heart Association works every day to ensure that everyone can live longer, healthier lives, and this conversation is going to help move us in that direction. Thank you so much.
Thank you so much for having it as a topic. I really appreciate your time.
Effective, equitable response in an emergency is part of the AHA's mission. If you have questions about health conditions, I would love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.